Um, Hello and welcome back to Exploring Lifestyles Legacies. Today once again I'm joined by Dr. George Maluleke, and lately I've been hearing the term Thunderclap headache go around quite a lot, and it sounds just very terrifying, very severe, very scary. So what exactly is that, and is there anything to worry about?
Yes, thank you, Kelvin, once again for having me. The name Thunderclap describes how suddenly and powerfully this type of headache will strike. And it's like a clap of thunder inside the head. It is severe and it is explosive. And you will see that the person will be starting behaving the way they never behaved before.
Sure.
And if you know them and you ask them, they will tell you that this is terrifying.
So what does that actually feel like? Is it like a lot of searing pain in their head, like there's been a stroke? Or is it more like just so much of a shock, it kind of scares them?
Yeah, so when I ask my patients, they say it often feels like being hit or punched very hard at the back of your head from nowhere. And the pain peaks within 30 to 60 seconds and can radiate to the neck. It may cause someone to feel sick, that is nausea, or to have confusion, dizziness, weakness, or blurred speech. If someone says this is the worst headache of my life, we don't take that for granted. We take it seriously because of what this might entail.
Right, okay, so
Yeah.
what does it entail? What actually causes something like this? Because it sounds like it's something to come out of nowhere, that's quite serious.
Yeah, in some people we find no clear cause, but we always want to rule out the most dangerous, sinister causes, which is something called a subarachnoid haemorrhage. This is a bleed that occurs between the brain and its covering membranes.
Right.
And also you can have what we call reversible cerebral vasoconstriction syndrome. This is sudden tightening of our brain arteries. Other causes could be also blood clots in the brain.
Okay.
Yeah.
So, how serious, if someone were to have this just out of nowhere, how serious would that actually be? Like, I know it's quite serious in terms of the symptoms you just said, but
Yeah.
if there is no symptoms that are found like those, are they just kind of fine, it just happened to them, or do they need to see a doctor again or something to try and find it?
You need to call emergency services immediately, because if it is a bleed in the brain, that can kill somebody.
Yeah.
So you will need to get that person to be in hospital as soon as possible. Don't let that person drive themselves to hospital. Don't drive them to hospital because of when somebody is bleeding in the brain, there is a way that they need to be carried. Sometimes the hospital might be too far for driving. They might need to be airlifted. Also, when you get to hospital, then imaging of the brain needs to be done immediately. This is a computed tomography or a CT scan or a magnetic resonance imaging or scan, or also called an MRI scan. We can also tap the fluid in the spine, called a lumbar puncture, to find the cause.
Right, okay.
A quick diagnosis literally saves lives, and even if it turns out to be benign, at least you have had your peace of mind when those investigations are done and are done timely. Because if it's not done timely and it's bleeding in the brain, it can kill the patient.
Okay.
Or cause severe illness or morbidity.
So you really have to be quite quick and thorough with this and make sure you get to the professionals. as soon as
Yes.
you can.
So the first thing, once again, is to call for help.
Okay.
Yeah.
So that's very good advice you just given us on that. Is
Yeah.
there anything else you want to add to that? Any closing words?
Yeah, headaches are common, but Thunderclap's headaches are not normal. If you ever experience the sudden worst headaches of your life, treat it as an emergency. Early action can prevent disability or death. Stay safe, stay stay informed, and please don't ignore those warning signs from your body.
Okay.
Yeah.
Well, full disclaimer here, because we're talking about such an important topic, this information in this video is for educational purposes only and should not be replaced in any medical profession or advice. Us telling you about this does not mean that you're equipped to handle a situation like this. So if you experience a sudden, severe or unusual headaches, or someone you know is experiencing this, do what we said, call the emergency services first and try and get a pressure roll. Even if it is a false alarm, it is better to do that and be safe than to not.
Certainly.
So
And thank you very much, Kelvin. If you like this sort of content, please subscribe. It is free for you to do that, but it motivates myself and Kelvin to keep on getting the most timely and correct information out there for you. Turn on the notification bell and like and comment. Please comment. Let's talk about this. Tell us about your waist headaches, and if you have ever had this subarachnoid bleed. Please comment so that you can also educate other people who might go through the same experience.
yeah,
And thank you very much.
thanks.
Yeah.
You've been mixing from the sun. You've been giving